Well, thank you, Chair Collins and Vice Chair Murray, and it's a pleasure to work with you and to work with my Vice Chair, Senator Baldwin. We've both, the shoe's been on the other foot where I've been her Vice Chair, and so we have a good history, I think, of working together. But for you all, for the Chair and Vice Chair of the full committee, I applaud your steadfast commitment to returning to regular order, and I hope that our work continues onto the floor this week. As we near the end of the subcommittee markups, I'd like to thank my fellow committee members for their input. Believe it or not, we received 12,548 total member requests for the Labor H Appropriations Bill. This bill is always one of the more difficult appropriations bills to negotiate. It's also one of the most consequential, I do think, in everyday lives of every one of our states. This is the third year Senator Baldwin and I have been at the helm of the Labor H Subcommittee, and I'm pleased to once again present a bipartisan bill to the full committee. The Labor H bill allocates limited taxpayer resources to key bipartisan priorities at a lower level than fiscal year 2025. The bill includes a number of bipartisan member priorities, such as greater investment in America's biomedical research, child care, education, mental and rural health, and continued efforts to combat the opioid epidemic, as the chair mentioned. As we work to right-size the federal government, this bill also includes careful, targeted decreases while ensuring that agencies have appropriate staffing levels to carry out their statutory responsibilities. The bill also maintains longstanding riders and excludes any new controversial riders. Our bill provides an increase for the National Institutes of Health to continue prioritizing biomedical research in the United States. This investment includes targeted increases for research in specific areas, such as Alzheimer's, diabetes, Parkinson's, women's health, maternal health, rare diseases, and cancer, including childhood cancer. We have also maintained funding for the NIH IDEA program that provides funding to 23 states that historically had lower levels of NIH funding, including my state of West Virginia. The IDEA program has been so important to West Virginia University and Marshall University. Today's bill also builds on our efforts to combat substance abuse, which remains a serious problem across the nation, and in particular, my home state of West Virginia, by providing for addiction treatment, prevention, research, and recovery programs. The bill also provides resources to support our health workforce. We hear about shortages all over the place, including nurses, geriatric providers, and professionals to respond to the addiction crisis, which will help providers across the country. The Labor HH bill, again, prioritizes our children, starting with early childhood, all the way through post-secondary education to make sure that our students are prepared for today's jobs and in the future. The bill also makes critical investments in our workforce to improve outcomes for workers looking to upskill or advance their careers. The bill includes funding for apprenticeship grants to support the administration's goal of creating 1 million active apprenticeships. The bill maintains important funding to support workers' rights and ensure the safety of our workplaces. I've just described several bipartisan programs we have included to improve the lives of Americans, and I encourage my colleagues to support the Labor H bill. I want to briefly thank all of the staff that worked to put this product together. On Senator Baldwin's staff, and apologies for mispronunciations in advance, Mike Gentile, Mark Laish, Megan Mott, Catherine Tumajan, Aaron Dugan, Amanda Beaumont, and Janie Delaney. On my own staff, I'd like to thank Emily Slack for finally going to bed last night at 3 o'clock in the morning, but she says she's going to sleep well tonight. Catherine Knowles, Elizabeth Joseph, Heather Wadika, and Jordan Lawler. I would like to thank in my personal office the head of my appropriations team, Thompson Moore, Dana Richter, and Mimi Vance for their great hard work. I'd also like to thank those on the full committee staff that have helped our subcommittees, Clint Trocchio, Ben Hammond, and the wonderful GPO team led by Valerie Hutton. So thank you again, Chair Collins and Vice Chair Murray. Thank you.